Let's now head over to Entebe, where the hospital is full to capacity as cases jumped from 3, yes, you had me right, 226, 3 to 126. Well, the hospital had earlier announced resuming outpatient services and dispatched some frontliners to other hospitals following reduced numbers. Haman Walonyolo is on ground to assess the might and plight of the frontliners who are actually working round the clock to ensure that our people are safe. A very good morning, Ivan Walonyolo. What's the latest where you are? Yes, very good morning, my brother. How are you doing this very fine morning, and what's the latest where you are in Entebe?
Well, a very good morning to you, Ramyo, and our audience, and a happy Heroes Day to everyone out there who has managed to at least put a penny onto the development of this country. But I am coming to you from Entebe Regional Referral Hospital in Wakiso District, where we continue to discuss COVID-19, which has brought, of course, panic, threats to the countrymen and the women, of course. If I can just give you brief, a while ago, I was here and told you that Entebe Regional Referral Hospital had played its purpose, its cause, and that they were slowing down the number of recovering patients. They were left with 3, but the director of this Regional Referral Hospital, Dr. Moses Mwanga, said that since they were getting almost rid of COVID, they were opening outpatient services to the rest of the people. But of course, on a sad note, of late cases have come to rise up to, we're speaking 600 right now, but we want to get an insight because when that came through, some of the frontliners from this health facility or hospital were sent or dispatched to go and also help some other facilities outside. But we want to get an insight of how really, as these cases rise, what is on ground, and the rest of the things. Dr. Moses Mwanga is here on set with me. Good morning, Doctor, and welcome with me on the morning at NTV.
Good morning to you. How are you?
I am happy to host you for the second time.
Thank you so much. And I'm also happy to share with you the experience we are having in the hospital.
Doctor, we were here last time and you told us that since you had slowed down the number to 3, if I can remember correctly, and you were to open outpatient services, how did the trend change along the way?
Yes, ideally the numbers had come down and we agreed that I think we can reopen other services because the community was demanding for other services, not only COVID. So we thought that since the numbers had decreased, we could open up, hoping that the second phase of the truck driver wouldn't drive it the direction it is now. Now, so far the numbers grew bigger. Initially, we co-opted other sister hospitals near the hospital to carry on the other services we are carrying as a regional referral hospital. Health centers like Katavi Health Center 3, Chigungu Health Center, and other private hospitals, we briefed them with drugs as well as staffs to help us cover the other part of the hospital, OPD as well as maternity services and the pediatric unit. But suddenly, when we started this second phase, the numbers increased, which threw us into a pandemic of not to reopen those other services. Because one case of COVID makes the environment unsafe for other services. Now we have over 128 cases, which makes it very difficult for us to reopen other services. So you find that even the community fears to come into the hospital where the environment is full of COVID-positive cases.
But we are told in the same time you also dispatched some of your frontliners to other hospitals. Did you recall them?
Yes, since we directed some of our patients to those hospitals, we had to give them staffs as well as logistics in terms of drugs, supplies. So we thought that rather than sending patients there, we could support them in terms of health workers. Now when the scourge, the numbers started increasing, we had to recall some of them, even recall some of the staffs who are still home. At the same juncture, we are happy that the ministry seconded some staffs to us in terms of doctors, nurses, ambulance drivers, psychosocial team to support us. And that number was seconded when we were scaling down. So we thought that probably it was misdirecting resources. But within a short time, the numbers grew bigger. So I think it was a blessing in disguise that these seconded staffs, plus the one we called and the staffs have helped us to handle this increasing number of truck drivers.
Doctor, you're saying you have over 120 people who are now undergoing treatment, but what's the capacity of this hospital?
I would say we presently have 140, confirmed 126, The capacity is 150 cases, but you have to put into consideration that even the health workers stay within the hospital facilities. We don't have accommodation, but we are accommodating them within the facility. So it brings the number to around, if you add the whole total, we are around 350 with the patients together within the same environment. So you find that you have to, we have a confirmed case zone, which is now full to capacity. Then we also have the suspects. The suspects don't stay longer. They could come in, stay for around 2 to 3 days, then we discharge them. But the confirmed cases stay longer, a minimum of 21 days. You know, when we are treating them, remember they are highly infectious, we need to space them, and somehow we have to be cautious that our staff, for their health and safety, we need to space these people. These people who come in when they are confirmed, we have to be mindful of their security. We have confined them and they are staying longer, isolated. So somehow, and the majority of them are foreigners. These people come from the countries surrounding Uganda. We have people coming from Kenya, Tanzania, Burundi, so Sudan has quite a big number, Somalia, Eritrea, they all come.
But Doctor, you're saying you are full to capacity. We want to understand, are you full just because of the accommodation, the beds, or the entire hospital is full and now cannot accommodate any other new case? Because we're seeing cases rising as we speak now.
I think we are full to capacity. Other infrastructure we have cannot accommodate people in this category, highly infectious disease. They have a bit open wards. It's a bit hard to confine people in those departments, because if I say that the entire hospital is full, then I'll be mistaken. But the infrastructure designed to handle these patients is full to capacity. The other areas which are remaining are not safe for them, because when you put them in that area, like you can't put adults in a pediatric ward, but we still have the pediatric ward empty. So I would say that the area designed to manage the confirmed cases is full.
But just, Doctor, a quick one also as well. But now, as you have these many raising cases, how has it been for you to cope up with them and the staff? And what are the behaviors like managing a big number that is almost now a school?
I think the first phase helped us to get reorganized and to know how to handle these highly infectious people. Because when we had a smaller number, it gave us a bit of a training and knowing how to handle them. Now when we got this bigger number, it was a matter of multiplying the strategy we used in the initial phase. So somehow we increased on the human resource, oriented them, using the experienced people we had in the first team. We also had to reorganize our infrastructure to ensure that the flow is safe for our staff to get infected. Remember, this disease is very highly infectious. A staff going in and staying longer there can get infected as well. So we had to plan that, put it into consideration. Logistics, having had the first phase, even our logistic management per se, we had to ensure that the flow of the logistics and even using it well within this has helped us to manage this bigger number. Then the reorganizing our staffs in terms of the experiences. So the staffs could also go in and see how do we handle these people. The behavior, we are lucky that the team we are having of the clients are doing the same job. They're all truck drivers. The majority of them are truck drivers, apart from a few other staffs.
Doctor, today is the Heroes Day, and as you speak right now, on behalf of your staffs, what would you have to say, your last words, Doctor?
I think I would say that my staffs are heroes, right away from the management team, because if you have the right leaders, they give the right steering of the people, I think it can give hope. My entire team, right away from the physicians, the nurses, the paramedics, the lab technicians, the drivers, the people who clean the wastes, the cleaners of the hospitals, the askaris, the security people, and we have now co-opted the red tops, because these people are becoming a bit unruly, so we have to bring in more security. So I think we are all heroes. I want to thank them for the work well done. I want to thank them for being committed. I want to thank them for being positive attitude. I think one thing which has helped us in a hospital is having the positive attitude with good leadership. I think it has really helped us, and teamwork.
Well, Dr. Mwanga, thank you very much for your time with us on Morning at NTV. We gladly say Happy Heroes Day to you as well. Wow. Rami, you get it from Dr. Moses Muwanga, who is the director of Entebe Regional Referral Hospital, giving us an update that since we left here last time, in fact, I remember there were 3 cases left, and they were promising that the outpatients would as well now come and receive a treatment from here, which did not come to pass because cases jumped. As we speak right now, he says 126 patients are undergoing treatment here, which actually shows that there is still more need to make sure that these patients as well can walk out of this hospital when they are COVID negative. But of course, we also say Happy Heroes Day to every health worker outside there. I want to hand over back to you in the studios. A very good morning to you and our audience.